Don't forget to wash your hands, doctor. Starting from kindergarten, teachers kept reminding kids like me, go wash your hands before dining and after toileting. During the flu season, washing hands frequently became an essential task that we need to do to protect ourselves. Washing hands ought to be the 101 for personal health care work. We care about our own health. We want the people around us to do the same thing, not only for their health benefits, but also for our own sake. Have we ever asked our doctors or nurse this question when visiting them? Have you washed your hands? Patients and families usually feel vulnerable, scared, and uncomfortable in a hospital room. Bringing up this question can be somewhat intimidating. Yet despite years of efforts to educate both clinicians and patients, studies show that hospital staff, on average, comply with hand-washing protocols, including cleansing with soap and water or alcohol-based gels, only about 50% of the time. Another 2 new studies also show that patients are not any more comfortable with the idea of asking doctors and medical staff to lather up. More hospitals have turned to electronic sensors, such as thermal imaging and video cameras, to monitor the staff's hand hygiene, and some are issuing badges that wirelessly record the staff's use of hand hygiene stations before entering a patient's room. Patients, instead of receiving information about infections and hand washing, would prefer having staff wear a button or light to indicate whether his or her hands have been washed. Hand hygiene is probably the most important thing that healthcare workers can do to protect their patients from infection, says John Jernigan, director of the Centers for Disease Control's hospital. When patients speak up, it helps create a culture of safety, he explains. Michael Getz, 50, has been hospitalized several times and says that he never had to remind Dr. Bump, his primary physician, to wash his hands. However, he has requested other hospital staff to do so. One doctor reacted negatively. It puts our relationship on a bad footing, Mr. Getz says. Yes, I run the risk of upsetting someone who has been taking care of me, but if they make a mistake, I am impacted or I die. A doctor comes into a room and the patient's wife says, "Doctor, I'm embarrassed to ask you this, but would you mind cleansing your hands before you begin?" The doctor replies, "Oh, I washed them right before I came in the room." Then the patient's wife says, "If you wouldn't mind, I'd like you to do it again, in front of me."